today we will discuss the topic Introduction to General Pharmacology and some definition and terms. So pharmacology is the science that deals with the study of drugs and their interaction with the living systems. The word pharmacology is derived from Greek word pharmakon, means drug, and logos means study. Now drug is a substance used in the diagnosis, prevention and treatment of disease. There is two divisions of pharmacology, that is pharmacokinetic and pharmacodynamic. So pharmacokinetic is the study of the absorption, distribution, metabolism and excretion of drugs, that is what is the body does to the drug. Kinesis means movement. Pharmacodynamics is the study of the effect of the drug on the body and their mechanism of action, that is what the drug does to the body. Therapeutics deals with the use of drugs in the prevention and treatment of diseases. Toxicology deals with the adverse effect of the drug and also the study of poisons, that is detection, prevention and treatment of poisoning. Toxicon means poison in Greek. Chemotherapy is the use of chemicals for the treatment of infection. The term now also used use of chemical to treat malignancies. Pharmacy is the science of identification, compounding and dispensing of drugs. It also includes collection, isolation, purification, synthesis and standardization of medical substances. Types of pharmacology. There is two types of pharmacology: experimental pharmacology and clinical pharmacology. So experimental pharmacology is done in the laboratory on experimental animals such as rodents and non-rodents. Clinical pharmacology on human subjects, normal or diseased. History of pharmacology. Knowledge of drugs and their use in diseases are as old as history of mankind. Primitive man gathered the knowledge of healing and medicines by observing the nature, noticing the animals while ill and personal experience after consuming plant and herbs as remedies. Ancient civilizations discovered that extract from plant, animal and minerals had medicinal effect on body tissue. These discoveries become the foundation of pharmacology. Pharmacology in the present form is relatively recent branch, about 100 years old. Historical development of pharmacology. Penshao, P-E-N-P-S-A-O, 2700 BC. It was the great herbal materia medica written in China. Kahun Papyrus, 2000 BC, is an oldest Egyptian document containing information about veterinary medicine and uterine diseases of women. Evers Papyrus, 1550 BC, also an Egyptian document containing information about number of diseases and 829 prescription where castor oil, opium like drug are being used. Hippocrates, 460 to 375 BC, a Greek physician considered father of medicine. He was the first person who recognized disease as abnormal reaction of body. He introduced use of metallic salt for the treatment of diseases. Theophrastus, 380 to 287 BC, a great philosopher called father of pharmacognosy. He classified medicinal plant on the basis of medicinal characteristics. Dioscorides, AD 57, a Greek produced one of the first materia medica of approximately 500 plant and remedies. Claudius Galen, AD 129 to 200, first attempt to consider the theoretical background of pharmacology. Paracelsus, 1493 to 1541, a Swiss scholar and alchemist often considered the grandfather of pharmacology. He introduced the use of chemicals for treatment of diseases. Valerius Cordus, 1540 to 1544, he compiled the first pharmacopoeia where the described technique for the preparation of drugs. Conversion of old medicine into the modern pharmacology start taking shape following the introduction of animal experimentation and isolation of active ingredient from plant. Francois Magendie, 1783 to 1855, a first pharmacologist, established the foundation of modern pharmacology. He developed experiment to elucidate the physiological processes and action of drug on the body. Rudolf Buchem, 1820 to 1879, German pharmacologist, a key figure in the development of pharmacology, who at the University of Dorpat created the first pharmacological institute. Friedrich Saturner, German pharmacist, assistant isolated morphine, the first pure drug in 1805. Claude Bernard, 1813 to 1878, considered father of experimental medicine, he identifies the site of action of curare. Oswald Schmitzberg, 1838 to 1921, father of pharmacology, established pharmacology as an independent discipline. He started teaching pharmacology in University of Strasbourg, French. John Jacob Abel, 1857 to 1938, founded first department of pharmacology in USA in the University of Michigan in 1893. In 1897, he established pharmacology department at Johnson Hopkins University. Abel also co-founded the Journal of Pharmacology and Experimental Therapeutics in 1909. Elmer Jones, 1912 to 2002, regarded as father of modern veterinary pharmacology. He authored first book of veterinary pharmacology, Therapeutics, in 1954. Scope of pharmacology. It provides the rational basis for the therapeutic use of the drug. Before the establishment of this discipline, even though many remedies were used, but doctors were reluctant to apply scientific principle to therapeutics. In 1920s, many synthetic chemicals were first introduced and the modern pharmaceutical companies began to develop. Scientific understanding of drug enables us to predict the pharmacological effect of a new chemical that will produce a specified therapeutic effect. The scope of pharmacology has expanded greatly over the last decade to incorporate many new approaches such as computer-assigned drug design, genetic screen, protein engineering, and use of novel drug delivery vehicles, including viruses and artificial cells. Our society needs pharmacologists who understand the basis of modern therapeutics for careers within academic, pharmaceutical, and government laboratories to study and develop tomorrow's drug. The source of drug information is received via pharmacopoeia, that is a book which contains a list of established and officially approved drugs with description of their physical and chemical characteristics and test for their identification, purity, methods of storage, etc. Some of the pharmacopoeias are Indian Pharmacopoeia, IP, British Pharmacopoeia, BP, European Pharmacopoeia, EP, United States of Pharmacopoeia, USP. Drug. As per WHO scientific groups, any substance or product that is used or intended to be used to modify or explore the physiological system or pathological state for the benefit of the recipients. Drug attachment. Medication chemically bind to specific sites called receptor sites. That is, agonist, chemical fit at receptor site wall. Antagonist, a chemical block another chemical from getting to a receptor. Partial agonist, attached to the receptor but only produce a small effect. Basics of drug action. Desired action, the expected response of a medication. Side effect, known and frequently experienced expected reaction to drug. Adverse reaction, unexpected, unpredictable reaction that are not related to usual effect of a normal dose of the drug. Sources of drug. The sources of drug could be natural or synthetic. Natural sources, plant, that is atropine, morphine, quinine, digoxin, pilocarpine, physostigmine. Second, animals, that is insulin, heparin, gonadotropins, and anti-toxic sera. Minerals, magnesium sulfate, aluminum hydroxide, iron, sulfur, and radioactive isotopes. Fourth, microorganisms. Antibacterial agents are obtained from some bacteria and fungi. We thus have penicillins, cephalosporins, tetracycline, and other antibiotics. Source of drugs. 5. Humans. Some drugs are obtained from men, that is immunoglobulin from blood, growth hormone from anterior pituitary, and chronic gonadotropins from the urine of pregnant women. Synthetic. Most drugs are now synthesized, that is quinolones, omeprazole, sulfonamides, pancuronium, neostigmine. Many drugs are obtained from cell culture, that is urokinase from cultured kidney cell. Some are now produced by recombinant DNA technology, that is human insulin, tissue plasmogen activator, and some drugs by hybridoma technique, that is monoclonal antibodies. Routes of drug administration. Drug may be administered by various routes. The choice of the route in a given patient depends on the properties of the drug and the patient requirements. A knowledge of advantages and disadvantages of the route of drug administration is very essential. The route can be broadly divided into enteral, parenteral, local. This is classification, systemic and local. Systemic, that is enteral and parenteral. Enteral, oral, sublingual, rectal. Parenteral, inhalational, like injection. Injection intravenous, intramuscular, subcutaneous, intraarterial, intraarticular, or intradermal. Transdermal. Local, skin topical, intranasal, inocular drops, mucosal, throat. Factor governing choice of routes. Physical and chemical properties of drug, that is solid, liquid, gas, solubility, stability, pH, irritancy. Site of desired action. Localized and approachable, generalized and non-approachable. Rate and extent of absorption from various routes. Effect of digestive juice and first pass effect. Rapidity of the desired response, emergency routine. Accuracy of doses, condition of the patient, unconscious, vomiting. First pass effect. First pass effect. The first pass effect is the term used for the hepatic metabolism of a pharmacological agent when it is absorbed from the gut and delivered to the liver by the portal circulation. The greater the first pass effect, the lower the bioavailability of the drug. Food and GI motility can affect drug absorption. Often patient instructions include a direction to take with food or take on any empty stomach. Absorption is slower with food for tetracycline and penicillin, etc. However, the propranolol bioavailability is higher after food, and for griseofulvin absorption is higher after a fatty meal. Bioavailability. Bioavailability is the rate and extent to which administered drug reaches the systemic circulation. For example, if 100 mg of a drug is administered orally and 70 mg is absorbed unchanged, the bioavailability is 0.7 or 70%. Determining bioavailability is important for calculating drug doses for intravenous routes of administration. Factor that influence bioavailability. So first pass hepatic metabolism, solubility of the drug, chemical instability, nature of the drug formulation. Drug nomenclature. A drug generally has three categories of names: chemical name, non-proprietary, official name, approved name, and proprietary brand name. So chemical name is it describes the substance is chemically, that is 1-isopropylamine 3,1-naphtho-thialoxypropanetool for propranolol. Non-proprietary, official name, approved name. The name is the official book accepted all over the world. Proprietary, that is brand name, Croatian for paracetamol. Drugs category: prescription drug and OTC drug. Prescription drug are used under only medical supervision and dispensed by an order of medical practitioner only. OTC drug can be sold over the counter without prescription. Essential medicines. Essential medicines are defined as the WHO are those drugs that satisfy the healthcare need of the majority of the population. They should therefore be available at all time in adequate amounts and in appropriate dosage form at a price the community can afford. Orphan drugs. These are drugs or biological products for diagnosis, treatment, prevention of a rare disease or condition or a more common disease, endemic only in resource-poor countries, for which there is no reasonable expectation that the cost of developing and marketing it will be recovered from the cells of that drug. Example: sodium nitrate, fomepizole, liposomal, amphotericin B, rifampicin, somatropin, desoxyn immune fab, desoxyn antibody, or leothyronin T3, and many more. Government is in developed countries offer tax benefit and offer offer incentive to pharmaceutical companies for developing and marketing orphan drugs, that is Orphan Drug Act in USA. Rational use of drugs. The rational use of drugs requires that patient receive medication appropriate to their clinical needs in dose that meet their own individual requirements for an adequate period of time and at the lowest cost to them and their community. Thank you.